So good morning everyone, I'm Najin and today I will talk about the cancer patient workshops. First of all, it is our context. In our workshops, talking about the target participants, that we will invite the people receiving the cancer treatments after the breast cancer diagnosis. So why we do we choose the breast cancer patients? It is because that the breast cancer is the most common cancer diagnosis amongst the female cancer cases in Hong Kong. And also it is the number 4 cancer killers. And talking about the symptoms of the breast cancer patients, including the lumps on the breast and also having the skin change or redness of the skins, or maybe very much including the nipple retractions. And talking about the treatment modalities of the breast cancer patients, it including the surgery, chemotherapy, hormone therapy, target therapy, and also the radiotherapy. And now talking about the mental and the physical status of the breast cancer patients. First, the mental status, including the anxious, low moods and the depressions, depressive disorders, or maybe resisting a lot of stress. And talking about the physical status, our patients may feel fatigued, may have having some pains or sleep disorders, and including the nausea and diarrhea. And on the other hand, it may including the social status changes. So the patients may having some social activity limitations due to the health, and also they may having some changes of the family function or the sexual functions changes, and the patient may feel isolated. And now talking about the workshops, and there are 2 activities within our workshops, including the aromatic therapies and the Tai Chi. First of all, talking about the aromatic therapies. The fragrance oil could be infused with the scents to provide the calming sensations. They can also be heated to release their scents into the air. It will be helpful in releasing the nausea and pains and stress by using the aromatic therapies. However, it is very safely used in our daily life, but the people with the cancers that is estrogen sensitive, including the breast cancers, the surface cancers, should avoid applying the large amounts of the tea tree oils to the skins. And talking about the benefits of the aromatic therapies, including the manage the pains and also improve the sleeping qualities and reduce the stress, anxious, maybe can treat the headaches. And now I'll give the task to another students.
Okay, and this is Loka Hay, and I will be responsible for the part of benefit and some examples of some aromatic therapy. And one of the major benefits is to stimulate the appetite. Eating is very important to keep breast cancer patients at a healthy weight and help preserve their muscle strength, which is associated with better overall survival. However, many anti-breast cancer treatments like radiotherapy, chemotherapy, and immunotherapy will cause several side effects, resulting in anorexia. These side effects include xerostomia, mouth sores, trismus, and odynophagia. Recently, a randomized study showed that the use of essential oil, like the ginger oil, can significantly alleviate the anorexia in breast cancer patients. And another benefit is to reduce the depression of these patients. Depression is a prevalent psychological symptom preceded by 21.5% breast cancer patients. These patients often experience a poor quality of life. And luckily, the reviewed study indicated the short-term benefit of aromatic therapy on depression, anxiety, and overall well-being is beneficial. And in a multi-center study of 20 essential oils, researchers found that it was as effective as the cognitive behavior therapy and preferred by more patients for emotional distress. Last but not least, it can enhance the sleeping quality. Some reports show us that more than 60% breast cancer patients have significant insomnia. The rest are frequently disturbed by pain, fever, and persistent cold sweat. Some essential oils, like the lavender oil, has a sleeping-inducing effect due to its sedative and anxiolytic effects. In fact, the result of randomized control trial revealed the effectiveness of lavender and peppermint in improving the sleeping quality of these patients. It indicated the positive effects of inhalation aromatic therapy on sleeping quality. And these are some examples of essential oils that can be used for breast cancer patients. Oils that help in stimulating the appetite may include these like bergamot oil, tangerine oil, spearmint oil, and ginger oil. We suggest combining the two oils to keep the appetite stimulation become longer, which also may help their digestion. And for oils that can reduce the depression, jasmine oil, sandalwood oil, rose oil, lavender oil, and basil oil may also be used. Using aromatherapy alongside with other treatments may also help boosting the mood and relieve the stress. And last but not least, oils that can help them to improve their sleeping quality include chamomile oil, lavender oil, cinnamon oil, and valerian oil. Many cancer patients report getting better sleeping quality after aromatic therapy due to its benefit of relaxation. And this is the end of my part. I'll pass my time to my groupmates.
Hello, I'm Chan Tan-Kit and I will be responsible for the part Tai Chi and its related benefits. So what is Tai Chi? Tai Chi is a traditional martial art in China that promotes the health of mind, body, spirit with the use of the vital energy, Qi. Practicing the Tai Chi can cultivate Qi to motivate the vital energy circulation, enhance, facilitate the self-healing. This is a series of gentle movement and breathing regulation that can improve the musculoskeletal functioning, reducing the level of anxiety and depression, as well as spiritual well-being. Hence, promotes the quality of life of the breast cancer patient. So the first benefit is that it can promote a clear thinking and focus. Breast cancer patients receiving the chemotherapy often complain the chemo brain. That means impair their thinking and focus. After practicing Tai Chi and Qigong, patients often report having a clear mind. In a pilot study, women who previously had chemotherapy and took a 60-minute Tai Chi class twice a week had sharper thinking at the end of 10 weeks of training in the Chinese martial art. Another benefit is pretty clear. That is, it can improve the balance and muscle strength and promote the physical health of the breast cancer patient. So 20% of the breast cancer patients who receive neurotoxic chemotherapy will experience a fall during treatment, and these fallers have higher scores of cell-report measure of neuropathy than non-fallers. Patients who perform Tai Chi show significant improvement in all measures of functional balance, physical performance, and reduced fear of falling. More effective than scratching, the risk of multiple falls in the Tai Chi groups was 55% lower than that of the scratching control group. Another benefit is that it can increase the flexibility. Tai Chi helps to scratch the muscle and improve the joint mobility in gentle and safe way. Measures show significant improvement across the 12-week period among the Tai Chi trained participants in flexatron, extension, adduction, and abduction. Given that the patient who receives psychosocial support shows improvement in the adduction only. Also, it will improve their aerobic capacity. So what is aerobic capacity? It is defined as the maximum amount of oxygen that the body can utilize during the extensive exercise. Patients who perform Tai Chi Chuan across 12 weeks shows a vital improvement in a 6-minute walk test with a decline in distance walked among the psychosocial support group participants. So you can see from the graph here, so this is the baseline, and this is 12 weeks after they have practicing the Tai Chi. So the total distance walked by the patient is dramatically increased from around 605 to 635. So one of the Tai Chi is the 5 animal play. Hardcore believe that moderate physical activity are required for the normal functioning of the human body. Digestion, absorption, and blood circulation can facilitate by motion. It is believed that mimicking the movement of tiger, bear, deer, monkey, and bird can strengthen the body functionality. So next, I will pass it to another student.
Hi, I'm Tou Wing, and I'm going to continue with the details of our designs on the workshop. And our workshop actually, it helps to support the social and the psychological needs of the breast cancer patients and their families through the workshops to help to express and organize their emotions. And also to reduce the pressure and the trouble caused by the cancer. And at the same time, we can broaden the social circle and to get to know different fellows, that means different other patients along the path to cure the cancer. And for the design of the workshop, our workshop is called the Dynamiostatic, and we expect there will be 20 participants. And we will invite the master of Tai Chi and a aromatherapy therapist. And for the location, we are going to hold our workshop on the 20th floor, the Malcolm Chan Memorial Buildings, the 31 Wiley Road, Ho Chi Minh. And here is our schedule. We are going to have the greetings, the aromatherapy, the recess, and the Tai Chi, and also the sharing section at last. And in total, we are going to have 2 hours for our workshop. And for the greetings, we will invite the patients to introduce themselves to each other. And also, we will also ask them to share their feelings or their personal experience after the cancer diagnosis. And also, some feelings about before the treatments like the surgery or the radiotherapy. And then followed by the aromatherapy section. And the aromatherapist will explain what is aromatherapy and as well as the benefits. And the participants can learn how to relax themselves through the aromatherapy. And we also would encourage the participants to try the essential oil. That means we will ask them to smell on the oil, and we will ask them to close their eye at the same time, and we will play 10 minutes music. And this is actually a simulation part, as we are going to ask them to imagine that they are on the beach during the 10 minutes music. And after the 10 minutes music, we will ask the participants to share on the simulation section. So we will be using the inhalation for the aromatherapy, and it actually gets access through the nasal passage, and which is the most effective and quickest way to get into the human body. And the effects of the essential oil can be strengthened by inhalation because the nose has direct contact with the brain. So for the Tai Chi section, the master of Tai Chi is going to teach our participants what is Tai Chi and also the benefits of Tai Chi, and the participants can learn how to strengthen their bodies through the Tai Chi. And in this section, the master will perform a set of 5 animal play, and the participants can follow the master and raise different questions about the play during the section. And for the 5 animal play, there are actually different sets of movement, and of course it's about 5 different types of animal, right? We have the tiger movement, the deer, the bear, the monkey, and the bird movements. And in a section, the participants can follow the Tai Chi master to perform different sets of movement. And I would say they can try to imitate how to perform these sets of play. And if they have any questions, they can raise it immediately to the master, and the master can, I'm sure that the master will perform a great animal play. And for this 5 animal play, it actually promotes all the 5 Zhang Wu organs and is suitable for the breast cancer patient. And it also helps to regulate the circulation in the meridian. And lastly, for this sharing session, we will invite the participants to share their feelings before and after the workshop. And we will also ask them what they have learned during the workshop, like the Tai Chi and the aromatherapy. And lastly, we will also encourage the participants to apply the aromatherapy and the Tai Chi, that means the 5 animal play, to apply them on their daily life in order to relieve themselves in terms of the mental or physical aspect. So here is our reference, and this is the end of our presentation. Thank you.